watching India Today.
We should have a transparency in terms of rates, types of medicine, diagnosis and all. Relative of the patient, they don't get a clear message from the doctors like what kind of diagnosis is required.
If you compare it with the international standards, where there is even in an ICU, there is a 1:1 ratio. Whereas in Indian healthcare, it is 1:15. That means one nurse or one doctor for 15 patients.
Most of the people are not aware of the health benefits, okay, especially with the rural region where the penetration of the insurance as an industry is very less.
Indian healthcare industry, which stood at $61.79 billion in 2017, is plagued by multiple issues. While the existing infrastructure is not enough to meet the growing needs of the population of the country, there is also inadequate outlay for health. According to the National Health Policy 2002, the government contribution to health sector constitutes only 0.9% of the GDP. In India, public expenditure on health is 17.3% of the total health expenditure as compared to 24.9% in China, 45.4% in Sri Lanka and 44.1% in USA. To make matters worse, lack of quality, low penetration and high prices of medicines and healthcare services, along with absence of affordable alternatives in the country, force high out-of-pocket expenses. Lack of transparency in healthcare services and products exacerbate the problem. Patients rarely know the real cost of care until after they've received it. As medical service consumers become more involved, conscious towards their healthcare upkeep and take on more responsibility for paying for it, there needs to be a major push for more transparency in the industry. The Indian consumer today faces high deductible health facilities and increasing skyrocketing medical expenses demand cost information, quality and information on affordability as well. Access to information regarding the quality and cost of healthcare services can inarguably help consumers make better decisions about their care. Increased transparency will drive positive patient outcomes and greater patient satisfaction, ultimately uplifting the health of all Indians.
If you look at number of available doctors in India, it's around 7 per 1,000 people. Right, and which is abysmally low. If you look at Japan, that number is around 21. Right, if you look at number of beds available per 1,000 people, it's around 9 in India, which Japan should be around 120, 130. You know, those kind of things. So obviously, infrastructure is one is lack of infrastructure. That's one. Two is the quality of infrastructure as well.
Meddco.com is the answer to most of your healthcare related woes. India's first digital pricing online platform in the healthcare sector, Meddco is an aggregator which provides healthcare services with dynamic pricing, online doctors' OPD appointment system, and information on free health camps across the country. The three pillars of the service are price transparency, offering clear prices of specific treatments in hospitals; affordability, users can choose from options of cost-effective healthcare services; availability, offering healthcare options near your location.
Well, Meddco has this SaaS-based product offering where we onboard hospitals who are looking to increase their visibility. And our platform offers such provisions wherein the hospitals can come across and they can list their medical treatment packages with us. What it happens is the consumers, the healthcare consumers who are looking for a good amount of information based on the surgical packages and their pricings and the cost that they're going to incur, if they can find this information on their platform, this is how we deem ourselves helpful to them.
Meddco has partnered with more than 1,000 healthcare providers who offer fixed-price treatment packages. Patients looking for treatments can search, compare packages and can make informed decisions regarding treatment expenses well before opting for the treatment. Apart from the regular healthcare services, Indian healthcare consumers face acute shortage of timely emergency medical services as well. The major challenges related to this sector in India are non-availability. There has been an increasing trend in the number of deaths caused due to unavailability of timely medical services. No transparency in transportation costs. Costs for availing emergency medical services have increased enormously over the years. No ETA or real-time location information after booking ambulances.
Unlike the Western world, in India we don't have a centralized emergency medical service number. Right? Some people call 108, some people call 102, those kind of things. So one, there is lack of it. Two, I think there is lack of awareness about it as well. If I'm traveling from Bombay to Bangalore and I come up and I need a emergency service, I don't know what number to call. I'm not even sure about whether I will get an ambulance if I call or not. So one, there is no accountability. I think 100% of emergency cases in India needs to be documented, and there has to be a tat on it in terms of saying how much time did the ambulance take to reach the spot.
MeddcoAmbulance.com is India's first emergency ambulance aggregator service which integrates city emergency ambulance transportation for patients and ambulance drivers as their partners onto a mobile technology platform. Aggregating emergency ambulance assistance across the sector not only helps in saving time in the crucial golden hour of trauma, but also reduces the costs.
That whenever there is a road traffic accident or any emergency things, you should definitely go with ambulance services, because ambulance services have a lot of facilities. It's our top priority that before shifting to hospital, patient to be in well condition.
Based on live location tracking system, users can book an ambulance instantly by using Meddco Ambulance app available on both Android and iOS. All you need to do is press the emergency button and the app connects to the nearest available ambulance around your location. One can use this on location or even book it for someone else in a different area. The app offers the following features. Easily book emergency ambulance with a press of a button. Convenient to use and find an ambulance near your location for elective or emergency booking. Track ambulance on GPS-based maps with real-time estimated arrival. Choose a free or paid ambulance available near you. Cost estimation depending upon distance traveled and choice of ambulance made. Various hospitals, clinics and NGOs organize health checkup camps to help prevention of common diseases. Meddco helps users find such preventive health checkup camps near their location. With price transparency being the key, Meddco has helped rebuild trust with patients, consumers, physicians, hospitals and healthcare insurers. It has played a pivotal role in optimizing costs and bringing efficiency in sourcing and streamlining the healthcare supply chain. Even hospitals have benefited with associating with Meddco, as an increase in customer satisfaction results in better results and relationship.